Hello, I'm Aimee Allbritton, one of the Senior Vice Presidents here at Memorial Health System, and I'm serving as our organization's Public Information Officer during the COVID-19 pandemic. We welcome you back to another of our COVID-19 conversations. I have a guest with me today here, Gina Carnduff. She's our System Director of Infection Prevention, and here to share really important information with all of you about how we can be able to not spread the COVID-19 virus. So Gina, thank you for being here.
Thank you for having me.
So first things first, you and I are wearing masks, pretty cute ones, yes. I might add, but we're wearing masks. So can you tell our community why that is and what that changes here in our health system and around the country, actually?
Right. So as we learn more about COVID-19 and how it spread, I mean, the important thing to remember is this virus is only about 4 months old from what we know. So things are changing by the minute. Yes. So this is a reflection of another change that the Centers for Disease Control, or CDC, put out earlier this week. They are now recommending for everyone, when you are going out in public or when you're unable to socially distance, that you wear some type of face covering. So this is different from the PPE, or personal protective equipment, that we put our healthcare workers in. Yeah. This is for the general public. So those essential things that you need to maybe go run out and get, such as going to the grocery store or the pharmacy, they now recommend putting some type of face covering, such as a cloth mask. And the reason is not to protect you from getting the virus, it's to protect others from you, if that makes sense. So we call this source control. Yeah. What this face covering does is, we have learned a lot about this virus. As I mentioned, we are now learning people are walking around potentially with the virus and not showing any signs or symptoms, and can potentially be spreading it to others. So this will form some kind of barrier to keep those germs contained within the mask and not being spread to others. As we know, COVID-19 spread primarily through the air, through droplets when someone coughs, talks, sneezes, laughs, those types of things.
So we're in a situation where within healthcare organizations, we actually have a two-step process, right? Because as our employees come in each day, we screen them for their temperature as well as for those symptoms. That helps us identify if they are a symptomatic carrier of the virus. But as you said, a lot of people don't have any symptoms, so this is a second layer of protection in case you or I happen to be shedding the virus and don't yet have the symptoms to know it.
That's absolutely right. And when we talk about shedding virus a lot, and a lot of people ask, what does that mean? You know, are we shedding through our fingers or our
Where's it coming
skin?
off it?
Shedding refers to actually through our mucous membranes, so through our nose, through our nares. And that's actually how we test for the virus. We stick a swab up the nose, and that's why a lot of the virus is coming out that way. And it also comes out through your mouth, as I talked about how it spread, coughing, sneezing, laughing, those types of things. Yeah.
So your job all the time with our health system is to help prevent any types of infections in the organization. So your role is to make sure that healthcare professionals understand that as much as possible. What is the one piece of advice that you're giving to healthcare professionals to help in this fight?
Yep, that's a really good question. You know, COVID-19 can actually be prevented in the same way that we prevent everything that we're familiar with, such as flu. So those basic hand hygiene practices are now being promoted more than ever, and that will help slow and stop the spread of disease and save lives. So what are those? Hand hygiene. We have known for ages hand hygiene prevents the transmission of disease. However, now with the hand sanitizer flying off the shelves, you can't see it. It makes me wonder, how many of you weren't washing your hands before? So hand hygiene is the most important. As I mentioned, COVID-19 spread primarily through the air. However, it is viable on surfaces. So you could potentially touch a contaminated surface. And then if you touch your eyes, nose, or mouth with an unwashed hand, that's how that virus gets into your system. A good analogy that I use with my husband and my kids, pretend like your hands have glitter on them, right? And so you don't want that glitter going anywhere on your face because it'll last there forever. So hand hygiene, anytime you touch anything questionable, that is the top way to prevent. And also social distancing, keeping at least 6 feet apart from others. From what we know about the virus, that's about the distance that it can go. So if you maintain a safe distance, that's how you prevent from getting in contact with that droplet.
So when people go out, as you mentioned, for essentials, grocery store, pharmacy, into those areas, what surfaces should they be most mindful of, and what can they do to further protect themselves when they're out?
Really great question. I always think of it as what is the potential for everyone's hands to touch? I immediately, when I go into the grocery store, that handle opening the door, if it's not an automatic door handle. Another thing that kind of makes me cringe is the pad that everyone touches with their debit card, right? So you swipe your card and everyone's touching those buttons. Grocery store, those are primary, the shopping carts, there's those disinfectant wipes there. Use them because you don't know who may have coughed, sneezed, or what have you on top of those. So those are the top things. Outside of the grocery store, I'm just thinking essential services such as going to get gas, gas nozzle. How many people's hands have touched that nozzle? And I'm certain those aren't clean. So again, just any questionable, when you're out and about, keep a little hand sanitizer with you. Always perform hand hygiene before touching your eyes, nose, or mouth, or getting in your car, those types of things.
What about gloves? Because we see some people wearing gloves out in the community. Can you talk more about that? Because I think there's a lot of confusion around that.
And to be honest, I don't understand. I don't get it. Gloves are not a substitute for hand hygiene. Gloves are actually used to protect people from hazards such as blood and chemicals, those types of things. They actually provide a false sense of security. People think with gloves, if they touch that debit card machine or push that card,
they're
and touch
protecting
that,
themselves.
And then they rub their eyes and nose or eat with them on. You are just putting that virus directly into your system. So gloves are not necessary. It's really just hand hygiene.
So it's almost like you're picking it up and then you now have another little way that you're carrying it around that you could then infect yourself with
the
it.
glitter on the hands that I talk about.
But I think part of that is people know that healthcare professionals often wear gloves to take care of people. What they don't realize is those gloves get changed every time they're used in between every patient. So that's how we prevent it from moving from one location to another. But if you go to the grocery store and then the pharmacy and then to get gas and you're wearing that same set of gloves, it's not doing the trick.
Right. So gloves are effective. Thank you for bringing that up when used correctly.
Yes.
And from my observation in the public, we are not doing that well. So please leave. And also, it's unnecessary use of PPE or personal protective equipment that we need for our frontline healthcare workers that there's currently shortages of across the nation.
So let's talk about that a little bit. So PPE, we're all learning new terms: social distancing, flattening the curve. PPE is now a common term out in the community. It's been a very common concept in healthcare of personal protective equipment. We actually have a grid that we use here at the health system, and I think one of your phrases you've said more in the last 6 weeks is follow the grid. Can you talk a little bit about how our colleagues know what PPE to use, and how are we doing on our supply? Do we have enough PPE to protect our colleagues?
Yep, really great, important questions. So as I mentioned in the beginning, the CDC guidance is changing constantly as we are learning more about the virus and how in the world can frontline healthcare workers keep up. We tried to make it as simple as possible, and I always say refer to the grid. This grid lists different types of scenarios for our frontline healthcare workers. And then it's a crosswalk, and then it actually outlines what piece of personal protective equipment they need for that patient care scenario, and that's how they know what to use. And it's a quick reference. They don't have to think too much, and it's updated.
Right. And so right now, you and I, if we look down here, we're not caring for patients right now. We're in a non-patient care area here in the Center for Learning Innovation. So it indicates we should use a cloth mask or non-medical grade PPE, again, so we can conserve the PPE when it's needed, and then practice social distancing, so staying 6 feet apart. So it helps us as we go throughout our day. What am I doing right now, and what kind of protection do I need?
Yep, so this grid makes sure that our colleagues and frontline care providers are using the personal protective equipment effectively, and also making sure that we have that supply for our healthcare workers. There's lots of chatter or potential rumors that healthcare organizations don't have enough PPE. Unfortunately, that is true for some healthcare organizations. However, our supply chain has been phenomenal in procuring the personal protective equipment that we need. And I think that in conjunction with our grid and educating our frontline folks to know the appropriate times when to use it and what to use has conserved our supply. We have no concerns at all at this time.
Which I think is a big relief for a lot of people, because it's certainly something people are talking about. So one other question about as people leave their homes, if they go out to the store to pick up some essentials and they come back home, do they need to be worried about it being on their clothes and anything special they need to do to try and get rid of the germs, if you will?
Sure. So a great question. Anytime you go out in public, now that we do have community spread, I'll be honest, there is a risk. There is a risk, as I mentioned, it's out in the community, and yes, it's on surfaces. That doesn't mean you should be terrified to go out. You just need to follow those appropriate infection prevention measures. So for example, when I'm out and about, I actually have a high-risk little one at home. So, I'm concerned about bringing that into my home, as much of you, I'm sure, are. I have a designated dirty spot in my garage that I'll call the hot zone.
The hot zone, yes.
Yeah, where when I come in, I leave my shoes because that virus likes to live on the ground as people cough and sneeze, and we don't disinfect floors as much. So that's a potential. In my purse or any outside bags that's been kind of all over, I leave in the dirty space until I can disinfect with a disinfectant wipe. So I do that. Perform hand hygiene. There is actually a really great infographic that outlines exactly what to do. We have that posted on our Memorial Health System page. So please refer to that. It tells you exactly what to do.
Yeah. And when you throw your clothes in the laundry, no special detergent, anything like that.
Right. So you can have a garment bag next to your hot zone or your dirty space where you can put your clothing. There's no special laundering that's required to get rid of coronavirus. So you just put it into your washer, and then it's just recommended you dry on a hot setting.
And they should do the same thing with the cloth masks that they're wearing out, right?
Yes, that's a really important piece. Wearing these cloth masks, make sure you launder them daily. What we know about cloth masks and why they're not appropriate for our frontline healthcare workers is, as I mentioned, it's to protect others from you. It's not to protect you from getting sick. There's actually some evidence out there that shows cloth masks can make you sicker if you are in direct contact with someone who has the disease. So important to launder them every day and care for them appropriately.
Okay, so you just mentioned a moment ago your daughter. So last question for you. When you're here in the health system, we're all looking to you as our infection prevention expert, and you're doing a phenomenal job of that. But when you go home, it's a different role, right? It's mom to both your son and your daughter, and a wife to your husband, Dominic. How are the two of you handling talking to the kids about COVID-19? And what advice do you have for the parents out there that you can pass on to help manage through this?
Sure. So, these are unprecedented times. We're all learning what a new normal is. But for my kids, it's again, those basic infection prevention practices. And I explained to them, this is why it's so important to perform hand hygiene and cover your cough and, all those different things that we talk about all the time. And why that is so important to prevent the spread. Also talk to them, children have a hard time understanding, why can't I go play with my friend across the street? So just working through that to protect them. And it's hard. They see mom gone at work for long hours every day and coming home. But we're learning our new normal, and
the kids are going through a whole new experience, right? They're learning how to Zoom at a very young age and do virtual dance classes. And
a shout out to my husband who's done all those things. His name is Dominic. I call him my stay-at-home Dom. So he's doing work from home, and but he's also been facilitating all those meetings and online dance classes for my daughter. And all that,
we call that our new normal, right? So Gina mentioned our Memorial Health System Facebook page, which we're really trying hard to be a resource for the community. This is one of the resources we have up there. This is our Do the Five, right? It's the new five, since we're not shaking hands or high-fiving. So all things that Gina talked about. Also, from the kids' perspective, we did share yesterday on our Facebook page essentially a coloring book that you can download, and it helps your kids. It has some things to talk through, like what about my day was good? What was challenging? They can write letters to their future self. They can do thank yous out to healthcare workers and essential workers. So, maybe get on and print one of those out, and the next time that you go to the pharmacy, have your kids color that before you go. When you go in and pick up your prescriptions, hand that to the pharmacist and let them know that you appreciate the work that they're doing. We put out all kinds of tools like that for parents, and certainly encourage you to follow along. If you're an adult and you need a little stress relief, maybe coloring would help that too, right? We could all use a little stress relief right now. So Well, Gina, we appreciate you being here and taking the time to share with our community. We hope you enjoyed this segment of COVID-19 conversations. We will be back in just a few days with Jay Rosehart, who's the president of our ambulatory group, and he's going to talk to us about some of the things that we're doing out in the community to help individuals who need care. Thanks for being with us today.